what we're finding is a lot of hospital chains are nervous about their future. There's a lot of uncertainty, and we also know just from looking at the projections about U.S. healthcare spending in the future that our country will go bankrupt if we don't get medical spending, especially Medicare spending, under control. And so in a sense, the current rate of inflation, I should rephrase that, the past rate of inflation until very recently was simply not sustainable. And that had a global importance, but for many healthcare providers, it was also a very local thing. Will my hospital be able to survive given the cost cuts or the reimbursement cuts and the cost pressures that they're under? And so, okay, everybody gets that we need to go to a more sustainable way of doing the care provision, but there are barriers to that. There are cost barriers, there are technology barriers, there are practice barriers. Well, we've seen there's a lot of attitudinal barriers. So the idea is that, for example, we need to just focus on cost. That actually can be short-sighted. So, for example, we see that if you just try to reduce the fees paid for certain procedures, you might end up stopping the procedures that actually could lead you to lower costs overall. One truism that seems to be borne out by data is that in general, higher quality care does cost less. And so one of the barriers is ensuring that you really do focus on quality in a way that also carries costs down. What needs to be set up is a system that pays better for making the right diagnosis early and then getting the right care most efficiently. And today the incentives just aren't there, and that's a big barrier. The fee-for-service model is good in that it incentivizes people to be efficient and to work hard, but it can also have negative incentives, and we have to just balance those. Technology plays a gigantic role. Certainly the information technology that allows us to identify practice variability and also coordinate care, huge. And in fact, most analysts believe that those two things, variations in practice and also coordination of care, are two of the key drivers. And those really need information technology to enable them. But then there's also, as I mentioned earlier, diagnostic technology. If getting the right diagnosis is the key, in so many cases, to getting a better outcome, then as we advance our imaging and other diagnostic technology, we should save costs. First, I'd say take the long view. We know that healthcare is a very local enterprise. It's very hard to generalize across the whole nation or across the whole world. And yet, sustainability means durability, means being there for a long time. So rather than just look at the short-term questions, try to focus on the long term. And that sometimes means making investments that pay off only over an extended period of time. The second, I think, is partnership. We have to, nobody can solve this on their own. And whether it's doctors working with hospitals, hospitals are working with manufacturers and vendors, or all of us working with payers in a different way, we have to find ways to work together.